I'd like to call to order this Paramedic Services Committee for June the 9th, 2016, and remind you to declare any pecuniary interest you may have. None declared. We have 3 action items, and the first one is the Wyerton lease.
Thank you. The recommendations before you, if there's any questions from anybody, it's just we haven't increased this lease for a few years, and they want an increase of $20 a month.
So there's a staff recommendation, and I have a mover. David, Mitch, any discussion? All in favor then? Opposed or anything? That's carried. Next item is donations.
This recommendation is from the donation that we got from Ivan Freibergers. I'd like to purchase life jackets, approximately $500 for some staff that they don't fit the current ones that we have.
Okay, there's a staff recommendation. Moved by Mitch, seconded by Paul. Any discussion? All in favor? That's carried. The next item, go ahead.
Next one is community paramedicine. I'm going to let Ray speak to this one.
Good. Okay, I think I can do it from here, Steve. Yeah. This one's just for information purposes. I think you'll remember back May and October 2014, we went into some grant funding with Huron and Perth County about community paramedicine, and we ran a referral program. Part of that was also to have a consultant do a little bit more to see what can be done after the study and what else should be done between the 3 different counties there. So the report is attached. The key recommendations, there are 7 of them. Basically that sustain the existing community paramedic program, look at the age threshold. Currently what we do is anybody over the age 65, it's flagged in our system, and they will do a referral on patients like that. What they're recommending is leave it more up to the judgment of the paramedics, so it's not just people over 65, it could be anybody that may benefit from having a referral done. Look at maybe expanding the referral program to include some more public education, whether that's diabetes and blood pressure management, falls prevention type things, and doing that in different areas, retirement complexes, seniors groups. I don't think the consultant knows the area very well. They mentioned malls as well. We don't have too many malls around, but that type of thing. Also that the counties promote the paramedic referral program through media outlets and things, just trying to get out there what we're doing. Work with planning further with Southwest Community Care Access Center, Southwest LIN, and any other agencies that might help in our efforts and that we can refer patients to. Currently we just refer to the CCAC, but we're looking at expanding that for even mental health patients. CCAC doesn't necessarily deal with that type of thing, but if we have patients that we could refer to Canadian Mental Health Services or something, that would be an option that we'd look at. And lastly, they had also recommended a shared community paramedic resource, such as a 1/3 FTE per county be established using existing resources. So moving forward, and in talking with the other counties, most of them we agree with, expanding the referral process, limiting or lowering the age limit. With CCAC being brought under the LIN, we'll keep working with them and figuring out how that whole structure will work, but we are still in discussions with them, and we still refer to the CCAC right now. And I know we have talked to HealthLink, so we've referred and working with them as well for other options, including public education ideas. We've also had some preliminary discussions with Bruce County Social Services, whether we can work in some of the county seniors' homes with modified duty staff. We're not looking at increasing, hiring someone else to do this type of thing, or sharing a 1/3 FTE with the other counties. I think it's more beneficial to use existing staff and ones that may be on light duties. And if we can run clinics like that with them in some of the seniors' homes, and that's a way we can just keep our program going in-house without any further costs. So that's pretty much what the plan's about. I can answer any questions if you did read it over. So.
Thanks. Any questions for Mr. Wood?
So the CCAC will still keep funding this program?
There is no cost to the program right now. We initially got some funding that was just to train all of our staff, but now everybody is trained, so there's no ongoing costs, and any training materials that we have, if we have new staff, it's there for them, so there's no additional cost for this program. Yeah.
If I may, Mr. Chair, the staff in the next few weeks, we will be sitting down to figure out exactly what the transfer of the CCAC will mean when it goes into the LHIN, because it will have implications on paramedic services, and it will have implications on long-term care for sure.
Okay. Any other questions? If not, thank you, gentlemen. So then we need a motion to adjourn. Milt, Robert, so we are adjourned, and we'll meet again